So just gentle mobilization like that. Hey folks, we're going to talk today about hip issues and hip mobility, okay? We're going to use Heavenly here as our little test subject. She doesn't really have hip issues, but we're going to pretend she does. She comes in here limping, and one of the signs of, see, look at that. One of the signs of hip issues is when somebody gives you the C sign. The C sign is it hurts right here, okay? Inguinal pain like this, or C sign pain, usually tells you that it's the hip, and that needs to be ruled out before you move on to something else. So she's got the C sign, she's limping around a little bit, it's a hip issue. One of the first things I'm going to try to figure out is if we've got gluteal tendinopathy. So gluteal tendinopathy is pain right here behind the knot. There's a little knot on your leg bone here, and pain just posterior to that where the glute medius attaches to your femur here. If you've got really solid pain right there that hurts when you lay on top of it, hurts when you lay on the good side, because when you lay on the good side you got the bad side stretched over when you're in bed, and then pain when you're going up and down the steps, there's a good chance we got gluteal tendinopathy. We've got a whole separate video on that, okay? Let's say it's not gluteal tendinopathy, and we've got a couple of positives that tell us we need more mobility in that hip. Now it gets a lot more difficult and a lot more specific than what we're going to do here today, but we're going to show you just some general ways that we would mobilize somebody's hip in a nice, fun, gentle way, okay? So lay on your back here for me. We're going to pretend it's this hip that's so bad. One thing, if we just wanted to adjust the hip, we would put her foot between my legs, don't kick, and then we would grab it and just tug and mobilize like that. Okay, so scoot back up there. You're little, I'm going to yank you right off the table. So let's say we want the capsule mobilized in specific directions. I have to thank my friend Dr. Ben Fergus for this. Okay, so the first thing we would do is we would pull from the inside outwards. So just gentle mobilization like that. That doesn't hurt, right? Feels kind of good, doesn't it? Yeah. And then we would go head to toe, superior to inferior. And then we would do 45 degrees. Then we can also do just regular repetitive mobilizations by just kind of pulsing it like that. You can do that in different directions as well. So you can see, for folks who have hip pain, who feel like their hips are a little bit stiff, for athletes that need more mobility, this is a really good way to loosen those hips up and get you functioning. So if you like this, give us a holler, 806-355-3000. Let's get you an appointment.